Hello, my name is Brian. I'm an N3 student, and today I'm going to be performing tracheostomy care. With tracheostomy care, I do want to say I want to have my sterile field. I want to sanitize it before I put my equipment on there. Sanitize it for 30 seconds, 45 seconds, depending on the sanitizer. Let it air dry for the appropriate amount of time. And I want to hyperoxygenate my patient. I want to have a continuous pulse ox on him to monitor his oxygen. My patient's name is Jerry Brown. His armband's right here. His birthday's 11/11. He has no allergies. And I also need to have my PPE. For this skill, I'm going to be using disposable catheter, so I do not need to clean it. And I am also going to be standing on my patient's left side because I'm left-handed. I think I'm ready to begin. Okay? So, hello, my name is Brian. I'm going to be your nurse for today, and today I'm just going to be performing tracheostomy care. Before I begin, let me provide privacy and hygiene. Make sure an obturator is near his bedside in case there's difficulties with his trach and your cannula. I'm going to go ahead and ask for your name and date of birth. Double check with his armband, make sure everything's correct. Name, date of birth, it's correct. He tells me his name is Jerry Brown, birthday 11/11. Okay, Mr. Brown, do you have any allergies? He has no known allergies. And I'm just going to be performing tracheostomy care. The reason for tracheostomy care is to remove any of your dressings and your inner cannula, give you a new dressing, give you a new inner cannula. That way there's no skin breakdown, no infection, and at the same time I'm going to be cleaning some secretions around that form. Do you have any questions? No? Okay, and for this procedure I'm going to pre-oxygenate you. That is, I'm going to be giving you oxygen. And now I want to raise my patient to the bedside, appropriate level, high Fowlers. And I'm going to go ahead and start washing my hands, provide PPE. Of course, I will get a new mask because I touched my eyes with it. Get a new mask, hand hygiene, get a new mask. Put it on properly. Now I'm going to go ahead and put on my PPE gown. At this moment, I want to again sanitize my working station and raise it to my waist level. Everything's working position. That way I don't break sterile field. Okay. There we go. I'm going to go ahead and hand hygiene one more time. Prep my sterile field by right now I can cross it because nothing's open. Once everything's open, I should worry about not crossing. Open my sterile soon. Grab the 1-inch border. Grab my Q-tips. Open them up carefully. There we go. As you can see there, they're both sterile. They haven't touched the 1-inch border. That one looks like it's touching the 1-inch border, so I'm gonna be safe and not use it. Just not gonna take any chances. There we go. As you can see, that one touches the 1-inch border, so I only have 2 swabs available. So I'm gonna ask my CNA to bring me 2 extra more swabs. So I grab the 2 swabs and put them carefully, and you know, I place them and they landed within my sterile field. So I'm going to move this one just a bit, just for the sake of continuity. Okay, drop them. You see I have 3 of them, disposable at my sterile field. Okay, so at this time, I'm going to go ahead and hyperoxygenate my patient, putting in the oxygen, 100% 1 minute. I'm going to go ahead and perform 1 sterile glove. Before I do that, I'm going to hand hygiene, perform my sterile glove. There we go. Fix my swabs. As you can see, only 3 of them are within the sterile field. It's fine, because I only need 3. Make sure I don't cross my sterile field. This is sterile to sterile, so I could freely move this around. I want to move it right here within my sterile field. And with my non-sterile hand, pour my saline. And I am going to go ahead and verbalize that since this is the only thing that's sterile in here is this right here, and it's going to have some weight on it, and if it moves, it shouldn't move because it should have saline in it and it will be heavy. So I'm going to dispose of this. So I only need 3. Put on my second sterile glove. There we go. Now I'm going to put the sterile Q-tips inside. And at this time, my patient has been hyperoxygenated. I'm going to commit 1 hand, remove oxygen. This is no longer clean. Once I take this out, turn it to the left 90 degrees to unlock it. Pinch, unlock it, pull forward towards me, upwards. Gently take it out, put it in the biohazard because it's non-disposable. And I'm going to take this dressing off by gently tugging on it. Again, this hand's no longer sterile. Gently tugging on it. And biohazard. At this moment, I'm going to pick a clean swab. I'm going to clean side, top, all the way to bottom. Clean the secretions. There we go. Away from my sterile field. Again, top. Take off all the secretions. Look at the, I'm also going to be assessing the tracheostomy. Make sure it's not infection, there's no skin breakdown. Last one. I'm going to go underneath. Make sure I don't poke or go inside the tracheostomy because you don't want that. And it is all clean. Drop it to the biohazard. And now I'm going to go ahead and grab my trach tube. Sterilely touch it, do not break sterile field. And I'm going to go ahead and insert my trach tube to put it inside. And I'm going to turn it to the right to lock it. It's locked. And lastly, at this point, my sterile procedure is semi-complete. I just got to put the non-raveled or the slit dressing. So at this point, I don't have to worry about sterile field besides this. Here we go. I want to make sure it fits within my slit, and I want to make sure I don't leave any creases. Make sure it's stabilized. Keep pushing it. Make sure I don't leave any creases. Creases cause skin breakdown. And at this point, I'm gonna say it's good. And now I'm going to replace the twist tie. I would typically do this by myself, I mean with another person. And I would go ahead and use my sterile gloves. Continue using my sterile gloves, I guess. Going to go ahead and open this up. You know, open it up. Since I'm only one person, since I'm just one person, I gotta replace it, keeping the old twist ties in there. As you can see, it's touching my gown and everything. And I would get a new one. Just ask my CNA to get me a new one. Take off my sterile gloves in the meantime. Take off my sterile gloves. 2 fingers underneath. Dispose of that. Hand hygiene. Put on regular gloves. I'm gonna pretend to put on regular gloves because I don't have any regular gloves out now. But put on regular gloves and open up a new packet. My CNA brought it. Open it up. Take it out. Make sure it doesn't touch anything. Make sure I'm careful with it. You can freely touch it because I have gloves on, but at the moment I don't have any real gloves, so I'm pretending. Now I'm going to put it underneath here. Going to go ahead. Make sure I don't move it too much because I want it stabilized. Alright, Mr. Brown, go ahead and go forward. Wrap it around his neck. Of course, I would be super careful and he wouldn't be a big bear. Make sure I leave 2 finger width length as free space to not provide any damage. Be gentle, grab it, make sure I don't mess with the catheter. Stabilize the catheter. Just keep stabilizing the catheter. And there we go. Catheter stable. I'm gonna remove the old twist tie now. As you can see, it accidentally pulled on that. In real life, it wouldn't be pulling on it. So that would be like not an accident, but in real life, it wouldn't be pulling on it. Because of that pull, it messed that whole thing up. We could disregard that. It wouldn't actually happen in real practice. And if it did, we're lucky it was a simulation. Remove the old one. Keep leaning forward because I can't see. Okay, there we go. There we go. Throw it away and remove my gloves. Hand hygiene. Dispose my gown appropriately. Hand hygiene again. Remove my facial mask. As you can see, my facial mask was slipping. That's because I have very used facial mask, so it's been slipping. If you've seen my nostrils, it's because it's old and I need new equipment. But if it was a new mask, it wouldn't be slipping off my nose. After this, after all my PPE is gone, I'm going to go ahead and just document what the dressing change I made, and document the stoma's quality, you know, if it's infection, if there's any skin breakdown, document, you know, his oxygen, how he tolerated the procedure, give him the call light, give him the safety rails, lower the bed, put him in high fowlers, and I want to say, you know, document the types of secretions that were present, if any, and I will date time initial it, and that will be it. Skills complete. All right, thank you.